I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Sheshadripuram, Bangalore. I'm also the Founder Director of Aviksha, a home-based primary care. My expertise is in HIV, palliative care and geriatric care. HIV mother can definitely have a healthy and negative baby. The mother, if she is HIV positive, she needs to undergo her viral load testing at the beginning so that her viral load is undetectable. And if it is not undetectable, she needs to see her HIV physician or her physician, whomever she is taking treatment from, to make sure that she does not have drug resistance. And why is her viral load not undetectable? So if a mother is undetectable, the viral load is undetectable, she can proceed to have a healthy baby, a normal healthy baby like any other mother with or without HIV.